Good afternoon. I'm Erica Sargent. Governor J.B. Pritzker holding a daily briefing on the coronavirus here in the state. Let's listen in.
I am joined here today by Mayor Lori Lightfoot and, of course, by Dr. Ngozi Ezike of our Illinois Department of Public Health, as well as Allison Arwady, the director of the Chicago Department of Public Health. The mayor and I would like to give you a further update on the work that we're doing to stand up our alternate care facility at McCormick Place. Our Illinois National Guard and the U.S. Army Corps of Engineers are on pace to have the first phase of this facility completed this week and the entire facility up and running over subsequent weeks. On Saturday, we received our first shipments of 500 beds, and Illinois Central Management Services and the U.S. Army Corps of Engineers began the initial build. We're aiming to have these first 500 beds up this week, followed by the next 500 by next week. The next 1,250 by the week of April 20th, and the final 750 acute care beds by the end of the month, bringing us to a total of 3,000 beds at McCormick Place. Based on best practices around the world about how to manage positive cases and contain this virus, McCormick will be dedicated mostly to non-acute COVID-19 patients, people whose condition could benefit from the care of medical professionals, but who are not likely to need a formal ICU. Of course, as I've said before, this is an evolving situation, and if our experts determine down the line that McCormick Place should be dedicated to a different set of criteria, we will shift our mission to follow the medical experts' best advice. I want to be clear that McCormick Place is dedicated to supporting our existing hospital system, not replacing our existing hospital system. Today in Chicago, there are hospitals that have a lot of COVID-19 patients, but there are also hospitals that are underutilized in our COVID response. The first place we are directing our patients is to existing hospital beds, maximizing our underutilized hospitals first. If we never have to go beyond our existing facilities, we will all be extremely happy. But since we can't guarantee that, and in fact, we don't have the data yet to suggest otherwise, we're actively building out capacity. In addition to McCormick Place in Chicago, the state, alongside the Army Corps, has formally launched work on 2 additional alternate care facilities: the former Advocate Sherman Hospital campus in Elgin and the Metro South Health Center in Blue Island. We're aiming to temporarily reopen both of these locations to ensure that we have the capacity that we need over the next several months. And I just want to say the work that the Illinois National Guard and the U.S. Army Corps of Engineers have already done, what they're capable of doing, is truly phenomenal. I mean, incredible stuff. On behalf of a grateful state, thank you to all of our guardsmen and to our Army Corps of Engineers. And I also want to especially thank Mayor Lightfoot and the entire city team for their partnership in this unprecedented project. Another critical step to meet the surge will be keeping our healthcare professionals safe and ready for new levels of work. And that's why we're maintaining and increasing our stocks of personal protective equipment, or PPE. As a reminder, PPE is something that Illinois' hospitals and nursing homes and first responders use every day, whether fighting a pandemic or not. That's why these facilities constantly source and stock their own PPE. They continue to do so now. So does the city of Chicago, which maintains its own stockpile due to its size. At the state level, our collection of PPE is meant to provide backup support to all of these smaller entities, including county public health departments, in times of need when they can't handle it themselves, times like this. In theory, the same is true of the federal government's stockpile in relation to that of the 50 states, though we have received from them only a small fraction of what we have asked for. Last week, I explained what federal contributions coming into Illinois looked like as a proportion of our asks, and I'll go over related updates momentarily. As of yesterday, our state stockpile, which is constantly changing frankly, because we're constantly pushing out shipments across the state, stood at 420,000 N95 masks, 41,000 surgical masks, 18,000 dust masks, 22,000 gowns, 340,000 gloves of various sizes, 108,000 goggles, and 73,000 face shields, to list a few of the more recognizable supply requests. Keep in mind that our inventory, after our most recent regular distributions, which we've been doing across the state throughout the month of March, including fully distributing all of the federal PPE that we received this month. Again, in our first request to the federal government, we asked for 1.2 million N95 masks. That was weeks and weeks ago. 900,000 surgical masks, 1.6 million gloves, 24,000 gowns, 24,000 goggles, 120,000 face shields, and 4,000 respirators. As I discussed last time, we received a fraction of what we asked for. Our second request to the federal government was larger than our first, but again, we received the same small order back from them. We've now distributed or are finalizing the distribution of all of these supplies. My administration has sent shipments to 96 local health departments and 155 different hospitals across the state, at least one time each, with some receiving multiple shipments, including additional PPE going to the most affected hospitals and local health departments in the Chicagoland area, where our cases are more concentrated. We've also delivered to our 10 regional healthcare coalition hospital leads, the Cook County Health Department, the Department of Corrections, and the Department of Human Services. All in all, that's 22 sites across the Chicago region, 41 sites across the Edwardsville region, 31 sites in and around Champaign, 36 sites around Peoria, 26 for Springfield, and 13 for Marion. We've also sent out smaller shipments to fulfill individual resource requests with select counties at the state police and again at the Department of Corrections. In total, these shipments distributed over 700,000 N95 masks, over 930,000 surgical masks, 108,000 gowns, 887,000 gloves, 32,300 safety glasses, and nearly 50,000 face shields. Today and tomorrow, we're shipping out additional PPE in strategic proportions to the collar counties, Cook, Lake, Will, DuPage, Kane, and then to Winnebago, and the health departments in Champaign, Peoria, McLean, Sangamon, Madison, and St. Clair, as well as, again, the 10 regional healthcare coalitions. My team, members of my governor's office, the IDPH, and NAIMA, continue to scour the global supply chain for additional PPE, and I'm proud to say that we've been able to make significant acquisitions, despite competition from other countries and even from our own federal government. By the end of the week, we'll have received shipments of 5.5 million N95 masks and 5.55 million surgical masks from state-executed contracts. And shortly after that, we'll see an additional 500,000 KN95 masks, 10,000 infrared thermometers, and 4 million surgical masks, with more contracts signed, sealed, and scheduled for delivery over the subsequent weeks. Our third federal shipment arrived yesterday. Our team at AIMA is sorting through this delivery now, and we'll make sure that those resources are delivered where they're needed as soon as possible. I will say this federal shipment still pales in comparison to our requests and appears to be even smaller than our previous two shipments from the federal government. My team is sorting through the shipment of 300,000 N95 masks the White House personally told me would be sent to our state. And while we do not have a final count on this yet, I can say with certainty that what they sent were not the N95 masks that were promised, but instead were surgical masks, which is not what we asked for. I can't emphasize enough how much we need the federal government to step up and amplify the size of their PPE deliveries to Illinois and, frankly, across the nation. PPE is the first line of defense for our healthcare workers. It's not a luxury that they should have to ration. The Defense Production Act that President Trump used to order one company to produce ventilators, that act can and should be wielded broadly to direct companies to produce ventilators and PPE and everything else that we need for U.S. residents. The Defense Production Act can be used to save lives and protect our doctors and our nurses and first responders, and I once again implore the President to utilize this important tool that is within his power. In the absence of aggressive action from the federal government, my team will continue to run down every possible lead to get what we need. I am proud to say that we've also received an outpouring of support from hundreds of corporations, small businesses, organizations, and individuals who have offered their supplies to support the state without hesitation. These donations are counted as a separate supply that assists us as an addition to our state stockpile. All in all, we've received over 5 million units that have been donated, PPE and other supplies, from masks to gloves to gowns to ear loops. In addition to all of our donors, I want to again thank the many elected officials and county leaders across this state, Republicans and Democrats alike, who have been calling and emailing my office with leads on where the next batch of help might come from. If you or your business would like to help us protect our first responders by donating PPE, please contact us at ppe.donations@illinois.gov. Someone will reach out to you if you'll email us your contact information. These donors are yet another true testament to the greatest strength of Illinois, the greatest strength, frankly, of the United States. Our people. It's our people that really count. Their tenacity, their ability to, without seeking fanfare or fame, always rise to meet the challenge of their time. It's the same spirit that drives members of the Illinois National Guard and the U.S. Army Corps of Engineers to work blindingly fast to ensure that we have the patient care space that we need. It's the same spirit that drove the 80-member Shawnee Quilters Guild in Carbondale to stitch together homemade masks for area nursing homes and essential workers, sewing surgical barrier material into the lining because of the savvy group's president, a retired surgical assistant. And I have to say, I was really impressed when I learned about this. And there's a wonderful, uplifting article I want to send you to look at online. It is about the sewing warriors. The article is in the Southern Illinoisan newspaper if you want to learn more about the genuine goodness emanating out of every corner of our state. It's the same spirit that led a retired Illinois Department of Human Services employee to reach out to the IDPH about how to donate her federal government stimulus check to the state's recovery fund. She doesn't have much of a savings, she said, but I'll quote, "I feel a responsibility to help in some way. I continue to pray for us all." And it's the same spirit that led the mayor of the village of Haynesville up in Lake County to contact his state legislators to see if they could contribute Haynesville's allotted capital bill dollars, their infrastructure funding from the Rebuild Illinois plan, which that same mayor fought so hard for in Springfield. He wanted to donate those dollars to the state's fight against COVID-19. So to the village of Haynesville, we can't take your money back, but we are so grateful for your desire to pitch in and your genuine patriotism. And here's the best part of all. It's within each and every one of us to tap into that spirit and hold on to it. Each and every one of us has the generosity and tenacity to see ourselves through this moment. Let's allow it to carry us through these times together. And someday soon, through to the other side. Thank you, and now I'd like to turn it over to a terrific partner, the mayor of the city of Chicago, Lori Lightfoot.
Thank you, Governor. Those are really remarkable stories that we should all reflect upon. This is a tough time, no doubt about it, but we have to not lose our sense of community and think about the good stories that are happening. People all over the city and state really stepping up in this tremendous time of need. Now, as we just heard from the governor, the COVID crisis is clearly unprecedented, and the impact is still growing. And the city of Chicago will continue to support and partner with this governor, his team, and this state in any way that we can. Right now in Chicago, the total number of confirmed cases of COVID-19 is doubling about every 3 to 4 days. Think about that for a moment. We are doing everything in our power to keep that from happening in terms of this escalating beyond our ability to manage it. But we will only succeed if everyone acts responsibly and abides by the governor's stay-at-home order. As I have said, and is true, staying home saves lives. As I mentioned last week, if we don't, in the city of Chicago alone, we're looking at upwards of 40,000 hospitalizations. Not cases, hospitalizations. In Chicago, our capacity for cases is still well ahead of demand for now. But it's truly a race against time, and we have nothing to waste. And we are constantly working with various leaders and stakeholders from government, along with countless businesses, community groups, faith organizations, and others. In addition to the updates just announced by Governor Pritzker in regards to PPE equipment, the Chicago Department of Public Health also has delivered 600,000 masks and 600,000 gloves to Chicago hospitals, in addition to similar types of equipment that we've delivered to first responders all across the city. The City of Chicago is also proud to be partnering with the governor, FEMA, MPEA, and the U.S. Army Corps of Engineers to develop surge capacity in McCormick Place that will be needed in the coming weeks, given the trajectory we are seeing. And we are actively working on staffing solutions for this site as well. Just like our recent partnerships with local hotels, this new space will relieve the burden on hospitals and help ensure every individual receives the care that they need. And putting this together, we look to the leadership of other cities for best practices. I want to personally thank the leadership in Seattle, Washington, as well as King County, Washington, San Francisco, Los Angeles, New York, and other cities and areas of the city for their continued advice and guidance. The use of McCormick Place signals a new phase in our citywide response to the COVID-19 crisis, as we expect to experience a peak in cases in the coming weeks. This surge capacity fits within the plan that we have described over the past few weeks, which includes quarantine and isolation space, beds for vulnerable populations, and providing supplies to healthcare workers. We will have other announcements later this week to add even more support for our important frontline workers, our first responders and healthcare workers. We have to lessen the stress on our healthcare system, and first responders is a key priority in this fight. We are working with Governor Pritzker and his team to implement a seamless system between government actors and healthcare providers to create capacity in response to the needs of this rapidly expanding number of infections. These actions are being undertaken in conjunction with our continued efforts to drive increased assistance for food and childcare, create financial supports for individuals and small businesses, and much more. In that same spirit, we will again call upon all Chicagoans from all walks of life to explore volunteer and employment opportunities during this crisis. Your city needs you. If you have healthcare training, we have a job for you. Doctors, nurses, certified medical assistants, and healthcare administrators. These personnel are critical to manage the surge of patients we anticipate. We are also looking for others who can help deliver food assistance, childcare, and much more. For those interested in stepping up, please visit chicago.gov/coronavirus and look to the resources page, because there's plenty of opportunities for you to step up in this time of need. But as I've said time and again, none of this will have the impact we need unless our residents stay home. And I must say, hats off to the vast majority of Chicagoans who got the message and are staying home to save lives. Each of our individual actions has a direct consequence on the lives of others like never before in our lifetime. That is why when it comes to this crisis, we each have a role to play, and staying home is a critical component of our healthcare strategy. Along with each and every one of our incredible healthcare workers in the Department of Public Health who have been doing the Lord's work to keep our residents healthy, as well as our first responders in the police department, the fire department, and OEMC, and city employees such as our CTA workers, sanitation workers, and custodial workers. And I'd be remiss if I also didn't stress the people at CPS who are working hard every single day to provide food for our CPS children and their families. We've been able to stay ahead of this crisis because of all of you, and we are deeply grateful for your incredible commitment during this time of sacrifice. We have to keep up those efforts